Welcome back, everybody. Bread and Butter Primary Care. I'm Dr. Stokes here, and we are continuing on with diabetes. And today's video is entitled Diabetes Lifestyle Changes, Diet and Exercise. So this is an extremely important subject, especially when it comes to treating and managing patients with type 2 diabetes. Type 1 diabetes lifestyle is very important because it's important that they control their diet so that they keep their sugars in a level. But type 2 diabetes is a lifestyle problem. Okay, the reason you have type 2 diabetes is a combination of your genetic, preponderance to get it, and then your lifestyle, what you eat, the exercise you participate in, all those things play into it. And so I always tell patients, the most powerful tool in our toolbox for treating type 2 diabetes is diet and exercise, lifestyle changes. Medications are helpful, they can be wonderful, but adjusting the way we eat and the activity levels are the key to controlling diabetes. And so I'd like to focus this video on a few very simple advice tips that you can give patients when starting out to help them change their lifestyle when they have diabetes. Now, there are entire textbooks on the best types of diet and activity for people who have diabetes, and there's glycemic index and counting carbs. I mean, there is like I said, you could take a 3-credit college course just on diabetic diets, and so that's certainly not the purpose of this video to go into all that detail. What I'd like this video to help with is you're seeing a patient, let's say you're a medical student or a PA student, you're seeing a patient and they have diabetes, and you're about to step out of the room and they're like, wait a minute, doc, what can I do as far as eating and things to help control my diabetes? You've got 2 minutes, you've already been in there, there's another patient waiting. How can you help quickly and rapidly in a way that's helpful for the patient? So that's what we're going to focus on. So first we'll talk about what I tell patients as far as diet. Quick and dirty for diabetes diet, I like to divide all foods up into 3 separate groups: the bad, the not so bad, and the good. Okay, and then group 1 is a reduction by at least in half. Group 2 is a change in reduction, and group 3 is an increase. So it's easier for me just to say, as far as diabetes and your diet is concerned, we're going to split foods up into 3 groups: bad, not so bad, and good. The bad group, I always say, that's the easy, kind of obvious things that you would think you would want to avoid if you have diabetes. So anything sweet. So we're talking candies, cookies, cakes, sodas, treats, desserts, pudding, pies, all that kind of stuff. The stuff that everyone knows is not good for you and that we're not supposed to eat much. That's the bad group. And so those are the things you want to eliminate as much as you can from your diet. Now, one thing I tell people with diabetes, and actually with anybody that I'm advising lifestyle changes, is the important thing is that there's a relative reduction in the intake. And so, for example, if you're talking to a patient, and I'll tell patients this, I'll say, let's say that you drink a 20-ounce regular Pepsi every single day. I'm not going to tell that person you can't drink Pepsi anymore. Although it would be very, very good for that person never to drink Pepsi anymore, it's just too much of a reduction too fast. They're not going to tolerate it, and they're not going to keep that up. So what I'll say, look, you drink a Pepsi every single day. What if you had just one every other day? Now, you might think I'm crazy saying, wait a minute, Dr. Stokes, you're telling diabetic patients to drink 4 Pepsis a week? And said, well, it depends. If they usually drink 8 Pepsis a week, then going down to 4 Pepsis a week would be excellent. If they're already drinking 4, then maybe go down to 2. So that's what that first group, I say, there's the bad group. You want to cut that in half. Whatever your current level is, take it down in half. Then there's the middle group, which is not the candies and sweets, but still the carbohydrates. So this is your tortillas, white bread, white noodles, potatoes, those types of foods. Those you want to switch and reduce. So you want to switch to whole grain as much as you can. So If you eat a lot of tortillas, go from white tortillas to whole grain tortillas. If you eat a lot of pasta, go to whole grain or protein pasta. If you eat a lot of potatoes, you can switch to sweet potatoes, although obviously those are kind of completely different foods, but is a little bit less carbohydrate. And so it's a switch and reduction. So again, if you eat tortillas every single day, maybe let's have tortillas every other day. So switch to whole grain and reduce. And then you've got the good group, which is your fruits, your vegetables, and your meats. And those things you want to actually increase the intake that you're having. Now, meat is a tricky one, and I tell my patients that as far as diabetes is concerned, controlling your sugar levels, meat is a safe food choice. That can be tricky because if you're eating a lot of fatty meats, hamburgers and fried meats and hot dogs and all that kind of stuff, there's a lot of fat, there's a lot of cholesterol. That's a whole nother issue, but it's not going to affect your sugar levels. And so as far as getting the A1C down, controlling the sugars, meat, fruits, vegetables, those are in the good group. You've got your carbohydrates, breads, pastas, and potatoes, change to whole grain and reduce. And you've got your naughty stuff, cookies, cakes, puddings, and pies, which you want to eliminate as much as possible, but at least cut that in half. Okay, so that took a little bit longer than usual, but the video's been going for 6 minutes, and it included the introduction. So you can see, really in just 3 or 4 minutes, you can sit down with someone and say, okay, as far as your diet with diabetes, split your foods into 3 different groups: the really bad, the not so bad, and the good. Really bad: cakes, cookies, sweets, puddings, and pies. You want to stop that as much as possible. Cut it in half from what you're currently doing. We'll talk again in a month and see how you're doing, and then we'll go down from there. The middle group: white breads, white pastas, potatoes. You want to switch to whole grain and reduce those as well. And then your meats, your fruits, and your vegetables, you can go ahead with that. One quick thing on fruits. Fruits you want to have be unaltered. Okay, so whole fruits with the skin, without any sweetening. So if you're going to eat raspberries, great, but don't put sugar on them. Eat apples, just an actual apple. Apple pie filling out of the can, that's in the naughty, can't eat, should reduce by half group. An apple that you just slice fresh, that's in the group that you can go ahead and enjoy. So those are the dietary things that I talk about. Quick, simple. I know it's an oversimplification. We didn't talk about glycemic index. We didn't talk about all those types of things, but especially people who are just starting with diabetes, it is overwhelming. There's so much information. There's so much going on. And so that's why I like to keep it simple. 3 groups, cut things in half. We'll talk more next month. As far as exercise, I like to do a similar thing where you just keep it very, very simple. 20 to 30 minutes of aerobic exercise 5 times a week. And so they say, what exercise should I do? What should I do to help with my diabetes? I say 20 to 30 minutes 5 times a week. How do you know if you should count what you're doing as exercise? Because I'll have patients tell me all the time, they'll say, well, Dr. Stokes, I work in a warehouse, I work as a mail delivery person, I walk 3 miles a day, I'm constantly walking and moving, I get tons of exercise. And I always say that's wonderful that you have an active job, and it's certainly helpful. But when I say to do 20 to 30 minutes of aerobic exercise a day, what that means is that you have a 20 to 30 minute period where you're breathing so hard you're unable to have a comfortable conversation. So again, there's entire textbooks written about the exercise that helps with diabetes and other conditions, and oftentimes in a patient room you just don't have time to go over all that. So that's why I say, if you want to know if your exercise is good enough, ask yourself, while I'm doing what I say is exercise, would I be able to have a comfortable conversation with someone while doing it? If you're going on a stroll, that's great, but if you could just talk and chat, you're not working hard enough. You should be walking fast enough, jogging fast enough, that you're breathing hard enough that you could not have a comfortable, easy conversation. If you're at that state and you maintain that for 20 minutes, then you're exercising like you should 20, 30 minutes a day to help with your diabetes. So I hope that's a helpful idea of diet and exercise things that can help with your diabetes. Again, very simple, just the beginning, but I hope that helps.